Kuala Lumpur, Malaysia, the National Heart Institute, IJN, has successfully carried out the first total aorta replacement surgery in Malaysia, adding another feather to its cap. The landmark achievement was made earlier this week when the procedure was carried out on a patient who suffered from thoracoabdominal aneurysm, or abnormal swelling of the aorta. IJN consultant cardiothoracic surgeon Dr. Paneer Selvam Krishna Moorthy said aneurysm could cause the vessel to bulge with possibility of rupture, adding that the risk of death from such condition was as high as 80%. He said repairing the aorta was a complicated process and some patients were left with the option of open surgery. However, with the expertise, facilities and capabilities available at IJN, we are able to utilize the latest techniques, from endovascular surgery to frozen elephant trunk, FET, to save more lives, he told a press conference at IJN here today. The FET is a procedure of hybrid aortic arch replacement which is used to repair aortic aneurysms. IJN Chief Executive Officer Datuk Seri Dr. Modazari Yaakob said patients would only need undergo a single operation under the procedure. Under the previous method, patients would have to undergo two separate procedures, which could increase the risks on the patients.